Hello friends, my name is Ravi and I'm working as a nurse in Canada. Yesterday I posted a video in Hindi regarding how to manage COVID-19 at various levels. Some of my friends requested that Hindi is not their primary language, so they had hard time understanding it. So I'm posting this second video for those who can understand English better and get benefited by it. So the management at individual level, I talked about self-isolation in case you have symptoms like fever, running nose, cough, body ache or sore throat. In Canada we have a different system. When we have these symptoms, we don't visit OPD or hospital right away if we have these symptoms. Rather, we call the helpline number and the nurse makes sure that we get tested for COVID-19 if we have these symptoms or if we qualify for that. But I know in other countries we might not have this system and you might need to visit the doctor. So please cover your mouth with any mask or 2 or 3 layered cloth, and then you visit the doctor. If possible for the doctor, they can come out of their room and then they can assess you. For the hospitals, I also requested that they can actually organize the medicine departments OPDs in a little bit more ventilated area, so the chances of spread of COVID-19 patients disease to others can be minimal. And after having these symptoms, patient should self-isolate themselves in a room with designated washroom if available, and all the food and drinks patient can be supplied by the family members or the friends. Those utensils and the towels or clothes patient is using should not be used by others, and patient and other family members should wash their hands frequently. He should not have visitors. So if we follow these instructions, the spread of this COVID-19 can be reduced to a good extent. We have been practicing these practices in Canada, and I hope you, wherever you are watching this video, will get benefited from it. Secondly, I was talking about managing the disease at community level. Now, as we know, we are talking about social distancing. So how much and how long? So we should actually maintain a gap of at least 6 feet from the next person. If we are going to a market or to a superstore or to a grocery store, try to make a distance of 6 feet at least. And as government of Canada suggested, we are talking about social distancing of months. It is not going to we are not going to get the solution in like next couple of days or next couple of weeks. We are talking about months of social distancing and practicing that can help reduce the transmission of infection at the community level. My third point is an urge or a request to the private sector, which is a great part of healthcare setup in various countries. They should come out and come up with their own plan to combat this warsome situation right now. We are talking about something more serious than money and economy here. We are talking about human lives. So please, guys, whoever you are in a private setup like a hospital or laboratory, open your heart and open your arms for this warsome situation and help the humanity. My last point is for people who are in government or who are sitting there at establishment of every government. I saw some data of New York State, and some of my friends are also working there. They told me that the system is getting exhausted day by day, and as the healthcare staff, doctors, nurses, or paramedical staff, they are getting those symptoms, we have to isolate them as well. So what happens over the time, there's a shortage of staff over the time, and we need extra staff. So the my request for the governments and healthcare establishments is, you guys can come up with an emergency plan B. For example, New York State is talking to the retired healthcare professionals and the people of private industry who are working in healthcare and who want to contribute voluntarily in this mission. So we can make a good team or good reserve force of healthcare workers where they can come up and help with this reserve team of retired healthcare professionals, and they can help in short staffing. So I know this is a hard time for all around the globe. Every country, all the economies are crashing. All countries are struggling to combat this situation, but we are in this together. Together we can and we will. Just keep the spirit high and keep cooperating with each other and keep maintaining the social distance. Thank you guys. Have a good day. Bye.